Hello again. Before we go into the treatment room to meet with Christine and Anthony, who are going to have their twin babies any moment now or very shortly, I just wanted to talk for a moment about having acupuncture during pregnancy, and I just want to disperse and make the myth go away that you cannot enjoy and benefit from acupuncture while you are pregnant. I don't know where the rumors have come from. There are certainly points on the body that you would prefer not to use when a woman is pregnant. And that's understandable because you do not want to move certain things, like you do not want to cause premature birth. And if a pregnancy is in jeopardy for other reasons, then you would certainly avoid certain points or maybe even avoid acupuncture. But generally, for a healthy woman, you can treat toothache or asthma or whatever needs treating during pregnancy with acupuncture without jeopardizing the pregnancy. So that is my point number one. And my second point is that acupressure has proven to be really useful during labor because the points, especially the pain point, this one here and then the one also between the big toe and the second toe, those two together have been proven to relieve headaches or any other aches and pains in the body. So we should all be aware of them and use them freely and intensely whenever we need to, and sometimes pain does get a little intense during labor. So I have seen this during phases throughout labor with some of my patients, that they just feel so much better when you massage and pummel and activate the energy to disperse the stagnation. And all forms of pain are really a form of stagnation. The energy gets stuck and accumulated, and you just need to move it and the person feels better. So now we will go into the treatment room and meet with Christine and Anthony. So what we're trying to do today is, and you can maybe show us all four of us for a moment. So what we're trying to do is preparation for labor. And there are two things to do. One is to help with pain, and the other one is to accelerate. And some of the points that we use in the acupressure serve both purposes. So I show you those first. When you really want to move ahead and help the process so that things accelerate. Oh yeah, and I forgot to say, and this is also a pain point. This is called Tai Chong Liver 3, and you just go there and pummel. And pummeling is just a sort of circular motion of your thumb, right? And you do that quite strongly. Yeah. And that would be a point for pain. And the coupling point to that for the pain is here, quite similar as it is between the big toe and the next toe. This one is between the thumb and the index finger. It's called Hegu. It's a large intestine point, and it's for pain. And I have used this during labor, and it really helped the woman who was in labor. Yeah. And what I did at the time when she let me, I did with one hand, I did this, and with the other hand, I did this. And then we were just pummeling simultaneously, but she told me while I was doing it, yeah, that feels a little better, that's better. Okay? So these 2 points, and I'll give you a chart at the end, which we will make, so that you have all the points. If there is tiredness and exhaustion and we want to put some more energy into the body, accumulate a little bit more energy or call it out, we treat this point. It is called San Yin Chao, 3 meeting points, spleen 6, and it has a kidney meridian, a liver meridian, and a spleen meridian. And a coupling point is when you go to where the eyes of the knees are, yeah? And you just go a little underneath there close to the shin bone. That is called Susan Lee Stomach 36. And the story about this point is that when you're really tired and you can't run anymore, if you treat this point, you can run for 3 more miles. So that's its name and its fame. Yeah. So you pummel that. So that should be energizing, yeah, as well as that. And if the pain is still great and you want to move along, you go on the outside of this ankle bone, and there is a point called Kunlun next to the mountain. It's called. And that's another pain and accelerator point. Yeah, and those are my favorite points of all of them. There's one other little thing, is that if you're feeling really tired and exhausted, then also moving your fingers along this ridge on the ear and doing like an ear massage, you know, like I'm doing it with my thumb, and I'm going quite, you know, you have to think in that situation, you have to get around her wherever you can. She may not want you to do anything because she's busy, you know, and sometimes it may be of such a nature that you have to follow her around in the room and just grab her by the ear and give her a little pummeling, or grab her hand and get something going. Yeah, but those are basically the points that make for a much easier labor than you would have without knowing them.
Okay.
Yeah, and I'll make sure that you have it all written in a shape so that you can recognize it at the time.
Yeah.
Okay.
Bring a flashcard.
Yeah, good.
Cool. Thank you.